had the Democratic Senate, I'd say, 50% chance he might be able to get something through on a public option. It would be different and more watered down, but they could maybe get something. And then I think drug pricing. They'll be big on trying to get something through on drug pricing, building off of the House bill that passed late last year. Lowering the age of eligibility to Medicare to 60, that's in his campaign agenda. I think that's a longer shot. That was put in really to satisfy Senator Sanders and their compromise kind of deal from June. I don't think that'll pass Congress, actually. It's too controversial. They could, though, get maybe a tax credit for caregivers, which is actually a very popular thing. This is something that's really resonating out there in the country, trying to help financially families that are taking care of particularly elderly parents and paying people who are doing that through a tax credit system. And then a big plus up in rural and mental health funding, which is also playing very, very well out on the campaign trail. All right, so now for those who were in my summer course, they probably heard this before, but basically I like to just put up this chart that sort of says, what is the big fight in American healthcare at core really about? And I think it sounds kind of technocratic, but this is kind of the way I see it, which is that the two sides are fighting over what is the best process for continually improving the productivity and quality of patient care. That is, controlling costs in the system, making it more productive, without diminishing the quality of care provided. Which way can we do that quicker and faster? And you got one side saying, let's get the government more involved. Let's regulate it, because an unregulated market is really misallocating resources, and proper regulation can get it more aligned to what's optimal. And so they have a bunch of initiatives they want to pursue that are basically governmental in nature. The other side says, hey, the government never improves productivity. It always kind of lowers it. We need a market system to improve productivity. And, here are the ideas we have to kind of get that done. Now, both sides have good arguments about why, hey, the other side's ideas are bad, right? So for those who are against the government control, they're going to say, hey, it always devolves into just sort of price setting and misallocated resources based on price setting by the government, which leads to oftentimes to just rationing by making people wait for their care. And then the pro-government folks will say about markets, hey, if this is such a good idea, why does nobody else do it? You look around the world and every other advanced economy, they basically are more on the governmental side than the market-based side. And they say, hey, that's for a reason, because you can't really make it work in an equitable way. You end up with lots of disparities, inequities, people not getting care they need, et cetera, et cetera. So, excuse me. So that's something that these guys, the governmental folks will say is it's a non-starter. Let me just throw up here, though, if I had my way, what I would do. And these are just four kind of basic areas. We'll talk more about it in the Q&A, but I would be more on the market-based side, obviously. And I think we could really improve things in American healthcare after the pandemic by moving toward broader insurance enrollment through an auto-enrollment default process for the uninsured. So you start to identify the uninsured, you give them a choice to go into a coverage plan. If they don't, you put them into a default plan, and if they have enough money, you start charging premiums to them for it. And then they say that you can go to another plan if you want, but you got to be in coverage one way or another. Give them insurance, but make them pay for it if they don't opt into something on their own. It's complicated administratively, but using state-based tax systems and other systems, it can be done. Price transparency. What I would do is have the federal government, this is something I think should be done nationally, start to require all providers of medical care services to issue pricing for some standardized package of clinical care. Start defining little bundles of what prices can be attached to, things that are shoppable services that happen in high volumes and people buy a lot, and make them give us a standard price for it. And then make it this complicated policy, but something called reference-based pricing. Basically, it says to the consumer, if you start shopping around and you find somebody who offers that service that's less costly than average, let you share in the savings. The insurer gets some of the savings, but you get some of the savings too. Reference-based pricing. And then third, structured choice in Medicare. This is something that's called premium support sometimes. It involves making the price competition for Medicare coverage more clear, more visible, and more relevant to the beneficiaries. And then fourth, employer-sponsored insurance. We need to reform it to move toward more disciplined cost control. Basically, two ideas here. One, to give all employers a tax credit if they move themselves toward a defined contribution system, and then require each of them to offer high quality managed care as one of the things their employees get to choose from. Anyway, so those are some basic ideas there. I'm going to stop sharing the slides now, but happy to answer any questions about all that, and take it away, whoever is next.
Yeah, thank you for your lecture slides there. I think you really cover. Actually, my first question was about the vaccinations, and so I'm glad you pretty in depth covered that.
Yeah.
And then it's good to hear your take as well as on like framing the problem of healthcare and how people want to solve it here. I'll ask one question, and we've got two questions already in the chat from
Okay.
Will and Professor Lenkowski. But I'll just go ahead and start. So I do want to know, in your view, how has the coronavirus pandemic, has it permanently restructured any part of our healthcare budget and administration?
Could you say that question again? I
Yeah,
got
yeah.
distracted
So
by
has
reading these questions. I'm sort of an analog kind of person. I was doing one thing at a time. Anyway, ask your question again. Sorry.
Yeah, sure. So has coronavirus and the whole pandemic permanently restructured any part of our healthcare budget or the way we administrate or where to go in the future with our healthcare system?
That's a good question. I mean, they designed the big bill that passed, the CARES Act, back in whatever, late February, early March. That was the biggest bill. And the aid that was provided in that directly to individuals and small businesses was not really health related. In the health side, they gave sort of special one-time support to hospitals and other providers. They, obviously have injected a huge amount of money into the public health system through a special fund that is contained and discretionary. So there hasn't yet been a permanent change. Now, the one thing that I think will change permanently will be equal reimbursement for telehealth services. I think that's sort of the most obvious thing that people say, wow, this is great, especially for certain kinds of care. People are saying, let's keep doing this and let's pay for it so that people don't have to go to the office every time they need to check on this or check on that and talk with their physician or perhaps a nurse practitioner. So I think that's probably the biggest thing that's coming. CMS has signaled they're going to make that a permanent change through regulations, but also might pass as an actual legislative provision. And I think if there's a President Biden, I don't think he and his team would reverse that. So I think telehealth is probably expanded and here to stay. The rest of the stuff has been is designed to be, not a permanent thing, one-time thing. Now, having said that, the one thing I didn't mention in my agenda items is I think there will be a COVID bill sometime in 2021 that might be labeled, let's not do this ever again, act, okay? Something that's sort of like pent up frustration with all the dysfunction and everything that went wrong, and trying to lay the predicate that in a permanent way that tries to make sure that doesn't happen ever again. Okay, so for instance, there needs to be a turnkey testing system in a pandemic, right? You have to have a network in place of labs that are ready to go that say, we're going to set aside everything else and by contract work with the government to set up a organized systematic testing system. That needs to be done in conjunction with a state-based but federally financed contact tracing system. So almost everybody, except for the president, agrees that these things are needed. And so I think those will probably happen in 2021. But they'll be for the next crisis, not this one, because it'll be too late. So I think, and a bunch of other things like that. Clinical trials, how to make sure we don't have such a messy trial system, that there needs to be a turnkey pandemic trial system so that the whole network of facilities kind of are required to participate in the trial system so we can get and figure out much more quickly what things work and what don't, by organizing everybody to point in the same direction instead of this cacophony we have now, which is everybody trying whatever they want. So I think those are kind of a couple of big things that people are going to say we need to fix all that before we have another one of these things happen. And of course, vaccines, sort of public health infrastructure, stockpile. Obviously, the national stockpile needs to be revisited and made. You can't deplete it and then not restock it. I mean, that was dumb. So there's a whole bunch of things like that people are going to say we got to fix these things so it doesn't ever happen again.
Awesome. I see Will had the first question in the chat. If Will, you want to ask in person?
Oh yeah, so it was kind of wordy in the chat, but basically I've been watching the ACB, the notorious ACB, in the Senate confirmation hearings recently, and there's a lot of back and forth about pre-existing conditions. Like the off-the-cuff remarks between Democrats saying you'll get rid of pre-existing condition coverage, and Republicans saying that's not the point of the Supreme Court, and also we also want to support people with pre-existing conditions. And I was wondering, because I know in our course over the summer we spoke about how the Republican plan is kind of similar to the Democrat plan in a lot of ways, and could you decipher what that means when they say yes, we want to support pre-existing conditions but not in the same way you want to? And then could you also talk about if the Republican healthcare plan has changed at all since this summer, which was kind of I think Mitch McConnell saying let's put the money that we currently have in the federal budget and kind of give it all to the states let them to decide what they want to do with it. And I may be parsing words here, but is that kind of ballparkish?
Ballparkish, yeah, for sure, ballparkish. This is a pretty long, complicated story. I think the first thing I'd say here is that the Republicans in some ways have kind of gotten themselves into a box, right?
Yeah.
They drove into this dead end themselves kind of purposely, sort of a lot of people were telling them, don't do this, and remember now what's happened here is that the Supreme Court ruled the whole law was constitutional in 2012.
Mm-hmm.
The Congress passed a repeal of the individual mandate, the tax on non-enrollment in health insurance in 2017. Some Republican attorneys general said, hey, now that the justification Roberts hung on to is gone, doesn't that mean that you're, and by the way, the language saying you have to get coverage is still in the statute because it was not repealable under reconciliation. And they justify that based on the Commerce Clause. Doesn't that mean Roberts has to say, hey, this language is now no longer constitutional? And if he has to say that language is no longer constitutional, can we say because of non-severability that the whole thing is unconstitutional? Okay, this line of argument is, I'm not a lawyer, so I'm not going to argue it on its legal basis. It's insane. It's never going to happen, right? The idea that 8 years after they said it was constitutional, the Supreme Court's going to come in and say, yeah, let's throw out the whole thing. 30 million people are getting subsidized by it. Medicaid has nothing to do with the mandate. There's no way it's going to happen. It's just not possible. It would bring into question all kinds of aspects of our constitutional system. And so let me put it as bluntly as I can. The Supreme Court's not that dumb, okay? If they threw this out, they'd just get themselves in such hot water, it would delegitimize the whole thing, okay? So they're never going to do that. Now, having said that, what's the difference between Republicans and Democrats on pre-existing conditions? Republicans, it's not really that clear because Republicans never passed a replace plan when they were, so they tried, but they never came to an agreement on it. in part because it's controversial on this subject. But if I had to put it, the balance of the party probably would say, let's get rid of the way they did it in the ACA, which is to just tell insurance companies you cannot take into account health status in any way when charging premiums. Republicans would probably say, no, you can do that, but only for people that opt out of insurance. If people stay continuously enrolled in coverage and never voluntarily get out, then you can't do that. You can't start charging people more just because, hey, they got sick, and then you're going to start jacking up their premiums. So I think if I had to summarize it, I'd say that that's probably still where the Republicans are. They would protect people as long as they stay continuously enrolled. But if someone voluntarily opted out, it's sort of like the inverse of the individual mandate. They'd say, well, within reason, insurers might be able to say, wait a second, now you've opted out, now you want to opt back in. How much, we need to check to see if you were just gaming the system, basically.
That makes sense.
That, I think, is sort of where Republicans would be. In terms of the broader question, you're right. There's a group of Republicans in the Senate that support block granting all the ACA money back to the states and saying to the states, you figure out how to subsidize people into health insurance. It doesn't have enough legs to get going, though. It's too controversial. So I think the truth of the matter is the ACA, despite all the hemming and hawing about it, it's pretty much baked already, into the system. And Republicans don't have enough juice to really move it in a big way off of where it is. So despite all the talk, I wouldn't expect any action on the ACA repeal and replace again. I don't think it'll happen again.
No, and I that's pretty much what I thought. I just wanted to hear more like the nuances about it, and the fact that you said my mind's failing me right now, but a point you made a second ago about how there's a block that supports it, but it doesn't have any legs to get anywhere is kind of like what I was getting at, because I was like, okay, it must just be all talk in the Senate saying Cruz saying to White House, we hear what you're saying, but they don't really have any tangible plan to support it. So
No.
The repeal and replace is all really good rhetoric, but I also agree, I don't think it'll actually happen or anything.
No.
Thank you.
Most of the rank and file have moved on. They're not really interested in talking about it. I'm sorry, we had Aruna, why don't you tell me what the next question is?
Yeah, it's Professor Lenkowski. It's along the same
Great.
lines, more Supreme Court oriented.
Yeah.
Yeah, I think you probably answered a lot of this already, but I want to take this opportunity to channel Senator Durbin. So, you're probably right. The Supreme Court is not dumb enough to take this case and overturn the ACA. But obviously, lots of Democrats disagree with that, Senator Durbin among them. And number two, Judge Barrett went out of her way, and I know, the politics of the confirmation require to do this, to emphasize how contingent, let's say, a decision in this case will be. It depends on the circumstances, discussions with her colleagues, she repeatedly went through that list of things that she'd have to consider and of course could not opine on during her confirmation. So let us just take a hypothetical. Suppose, in fact, that they do overturn ACA in this decision. What happens next?
If they did it, I think it would be thrown back into the Congress pretty quickly. First of all, you'd have Republican senators and Republican House members panic that they got, hundreds of thousands, millions of constituents about to be thrown off of coverage, okay? So they would have to themselves probably be in favor of restoring it. Now, a lot depends on how the makeup of the votes, what does the Congress look like at the moment this happens? The Republicans who are really want the Supreme Court to do this are saying, well, yeah, it's true, we'd have to reinstate a lot of the ACA, but more on our terms. And we could get some detail changes that, move it in our direction. This gives us massive leverage, et cetera. maybe, maybe not. I mean, depends on the makeup of the Congress, right? Makeup of the Congress. And so I think the the Medicaid expansion would get reinstated. You can't throw, there's been no precedent in our history of having, 20 million people being pushed off of a benefit program all at once, right? Which is basically what would happen. So that, I don't see it happening. I think they'd have to reinstate the Medicaid expansion. Moreover, there's another 10 million people who are on the ACA subsidy structure. And, they're getting 10, 12, 13, $15,000 in subsidies to buy health insurance. And all of a sudden that's going to be taken away from them and they have to pay for it all on their own. I don't see that happening either. So I think they'd have to reinstate a lot of this stuff. So one of the great ironies here is you might end up with Republican fingerprints on the ACA. After all, they'll give it a new name, the Bipartisan Affordable Care Act or something, right? But you might end up with a lot of Republican votes for the same. I don't mean to minimize it, but they would make some changes and give them a fig leaf to move in a different direction. But the substance of it would probably be very similar.
Yeah, that's kind of what I would have thought too. And while there's clearly no danger of losing the confirmation, or there apparently not, if it had all been close, I would have expected at least one of the Republican members, or a couple, I think Senator Lee maybe, are both on the Finance Committee and the Judiciary Committee, may have then said, well, look, even if this is overturned, we'll keep some of it. But no need to go that far given the likely vote on the confirmation.
Yeah, I think most of them, in fact, I think you guys have all followed the hearing closer than I did. I really didn't follow it that closely, but of what I read, I think Senator Graham himself sort of said in so many words, paraphrasing, hey, this isn't going to happen. The ACA is not going to get overturned. So, I mean, I think the Democrats, frankly, in the hearing, are playing it up, the possibility, because it's to their advantage politically, obviously. So anyway,
Awesome.
Okay, next question.
Yeah, Ty, do you want to go ahead?
Hi, good to see you again, Ty.
You too. So the Biden campaign has touted investments in testing, tracing, and PPE, whereas the Trump campaign has argued that their proposal is effectively the status quo. So do you anticipate substantial changes in COVID policy in the event of a Biden victory?
I do. I think the Trump administration is playing a kind of a, I'll just be honest. I don't think it's inexplicable sort of what they have done a little bit, because I think they want to say that they've been aggressive in trying to contain the virus. At the same time, they're saying these other people would close the economy down and we've got the economy open and it's working better now. But the truth is, the policy that they've implemented has been one of avoid responsibility at the federal level, make this a state-based process mainly, and pursue, to be honest, they've used to deny they were doing it. Now they're kind of running up right next to it, is to say pursue essentially a policy of herd immunity for the healthy population as quickly as possible, which is exploding now on the front pages because it's become clear that that is their policy. And that's not the same as the Biden plan, And so if you hear Secretary Azar talk or the White House advisors talk, they basically say, what we need now is just for healthy people to go about their business, reopen the country, and protect the vulnerable. That's their policy, officially. And that doesn't involve huge amounts of testing and contact. They don't really want any of that. They just want to open up the economy, let people go about their business, and protect what they view as the most vulnerable people with comorbidities, businesses where there's particular danger, and obviously the elderly. So, the trouble for them is that they cannot explain, because there's no way to explain, how do you protect the vulnerable when there's community spread that's massive and all over the place, right? If everybody's getting it, how do you prevent it from jumping into vulnerable populations? Because there are people that are workers that go into the homes of these people. They have younger family members. You can't, the elderly can't, they're not going to be in a bubble like the NBA. So they're going to get it. And that's what's happening, right? A lot of vulnerable people are still getting it, and they're getting sick, and some of them are dying. And so I think there'll be a massive change in policy if Biden were to win, to be honest with you. I think it'll be pretty immediate.
Luis, I think you had a question that you wanted to ask Mr. Capretta.
Yeah, I'll jump in and just very quickly introduce myself as well. My name is Luis Perales. I work at AEI as well. So Aruna, thanks so much for organizing this event, as well as everyone else on the Executive Council. If anyone attending the event wants to learn more about AEI, please shout to Aruna, and he can share my email. We'd be happy to connect. But Mr. Capretta, quick question. So you've been working on healthcare policy beyond just this immediate battle or these immediate debates. I guess, broadly speaking, how have you seen both conservatives and liberals shift, and how have your own views, I guess, shifted as well?
Based on the pandemic or just over the years?
Oh, even beyond the pandemic, just the arc of how
over the years, yeah.
Parties are addressing this.
Well, I think for me, I think the thing I've kind of come to after working on this a lot is it's a very big and massive system with lots of inertia to it. And, you're not going to turn on a dime changes to it. It's just too big. Too many people are dependent on it. Too many institutions are built up around it. Big institution. Let's think of all the big medical centers around the country, right? They're all based on Medicare and Medicaid payments, and the physician training system we have, and the hospital accreditation systems, and the insurance plans, and et cetera, et cetera, et cetera. And, upending all of that and changing how it's all regulated and paid for just is not easy to do. And so everything we end up doing is kind of incremental. And I think what I see is, if we could ever get to a point, we might want to try to start having both parties say, we're going to have a mixed system. Isn't going to be one or the other. It's not going to be fully governmental, and it's not going to be fully, the person who my chair is named after might going to be fully the Milton Friedman designed health system, And so it's going to end up being a mixed bag in a sense. What we need to do is make sure that mix of public regulation and private incentives works as best as we can get it to deliver really good healthcare for the public. And one thing to keep in mind in that regard, and this pandemic has brought it into sharp relief, is that public health should be something that both sides, Republicans should agree, has to be tax financed. You're not going to have a public health system that is spontaneously paid for from private money, because there's an externality there, right? Your investment in broad public health, you're going to spend $1,000 and your direct benefit is going to be 10. And it's going to, the fact that, everybody else benefits from it, you can't internalize in the return to you. And so it's only going to be financed from public money, which is why, we have mandatory vaccination policies, right? Because you get a vaccine has an externality that benefits lots of other people. They won't get sick from you, okay? And, you have a contact tracing system. That's not going to be privately financed, unless you have a very self-contained institution like a university. But for the broader community and population, this can have to be a state-financed thing with federal help. And the testing system in a pandemic, is not going to just spontaneously emerge. You have to kind of have a tax-financed way of paying for it. So I think we can come to an agreement on public health, tax-financed and good public health, and then above it, a private public somewhat regulated, but also a lot of room for private incentive system of delivering medical services that are really delivered to individuals, not to the broader public. And I think that's, a framework that we might want to start thinking about how to sell and get both parties to buy into. Right now the parties are swinging back and forth, and for the Republicans, they should worry that the other side has more juice and they might win they might win this long-term battle more readily than the Republicans.
Thank you. David, do you have something you wanted to bring up?
Sure. Yeah. First of all, thank you so much for your presentation. It was very informative. So on kind of, I don't want to shift back, but I guess I have, or I guess I am.
That's okay.
To the Affordable Care Act. Another part of that bill that seemed to be very popular was the stay on your parents' health care plan until you're 26. So I saw I saw that you've done a lot of research in regards to like healthcare economy as well. What impact does that element of the bill have on the economy, and how quickly do you think, should this bill get struck down, both parties will come together to pass a bill to reinstate that part of the plan?
Yeah, I think that is one of the more popular elements, and but maybe to the detriment of the functioning of the rest of the plan, right? So you pulled all these healthy post-college but pre-stable workforce people. They're probably in the workforce, but a lot of them are young and change jobs a lot, right? This is your immediate future for a lot of you. And they're in graduate school or this or that, and they end up on their parents' policies. So therefore, they're not buying insurance through the exchanges, which is basically the non-group individual market for people that don't have employer coverage. So all of these people that are now on their parents' plan, if they weren't on their parents' plan, would probably have to buy their insurance through the exchanges. And because they're not doing so, all those young, healthy people aren't, helping the risk pool that's now in the ACA exchanges. So the ACA exchanges have devolved over the last 6 years into being primarily heavily subsidized and very sick people, instead of the broader pool that people wanted it to be. So there's only about 10 million people in the exchanges. At enactment, the administration and CBO thought, hey, there might be 25 million people in the exchanges. And if you had 25 million people, that'd probably mean 15 million of them would be, there because they can't get it somewhere else, and they're basically healthy. As it is, it's basically only the very heavily subsidized people and those people who are benefiting from the pre-existing condition protections who are going into the exchanges. So it's a much narrower, almost like a high-risk pool run by the ACA. And part of the reason that is they gave insurance options to different groups, including 21 to 26-year-olds, which is a pretty big group of people. If I remember right, it's people on that and qualify for that. There's several million people who qualify for that, I think. So it's a pretty big group.
Thank you so much.
Sure. Oh, but your question was, if it got struck down, would it get reinstated? Probably. Because all these people are like it, and they'd suddenly become uninsured. And so I think the Republicans would end up agreeing to something along those lines.
So continuing on, like with just looking at our aged people, this is sort of a question that I was talking to the Grant about, but many people our age and a little older are worried about not receiving like Social Security or Medicare benefits down the line because the budget's running out or whatever they have. So is that true given the current structure, and what steps would Congress take to prevent that?
It is true, unfortunately. So, this is a big problem with very few people paying attention to it or doing anything serious about it in Washington or really throughout the country, right? So we just have entered a new era in terms of public borrowing, and a lot of people are saying don't take it too seriously. In a certain sense, there's an element of truth to the argument that now's not the time to be worrying about the debt. Okay, to some degree, they're right. We're in the middle of this once in a century very bad crisis. It's both a public health emergency and an economic catastrophe. And, in that kind of environment, you're going to have a lot of public borrowing to cushion the blows and put a floor underneath people's livelihoods so that they don't just come crashing down. And so they're probably going to have to pass another big bill. They couldn't come to an agreement before the election, it doesn't look like, but either in December or January, February, they're going to have to do another big bill. You're going to have a lot of people hurting out there, and the economy's not going to be doing very well. So they're going to end up doing another big, $2 trillion borrowing bill on top of the $4 trillion they've already done So it's a big event fiscally that's happened here. Having said all that, just because we should do it doesn't mean we shouldn't then also then say, okay, where are we going with all this? And my argument really is that the political system needs to stop worrying about what the deficit is in 2025 and start worrying about what it'll be in 2040 and 2050, because it's really a long run question. Our democracy does not deal well with challenges that are sort of existential and long term. We just sort of drift and hope it'll get worked out, and sometimes it does. We get lucky. But when you have to plan a solution that requires 20 years of foresight and working it through, those are things are hard, right? Because our electoral cycle is way shorter than that. And so, but that's the kind of problem this is. This is a 20 and 30 year problem. And it involves making adjustments, some big, some minor now, but they grow into big solutions. In other words, if you tweak these big programs now, you can kind of save a lot of money down the road in 2050. You won't save that much right away, but they're the kind of changes that will make a difference over the long run. And I've written this up recently. We just did a book. Okay, this is my way to plug our book, Luis, right? So yesterday, AEI released a book called Priorities. What is it called? Governing Priorities. Yeah. Governing Priorities, an agenda for the next president, something to that effect. I got to remember the subtitle. But anyway, it's called, you can look it up online, Governing Priorities AEI. And it has a series of chapters in it. And I wrote one about the debt. And I basically said there are 5 kind of things they should do right away. Do them now, but they're not going to produce big effects till much farther down the road. One would be index Social Security retirement age to longevity. So instead of trying to figure it out all the time, just sort of say, as we improve our mortality rates, that is lowering them at younger ages, we should increase the normal age at which people retire by a couple of months every once in a while, okay? Indexing that now 67 to some growing number. That's one. Number 2 would be to create small personal accounts in Social Security so that we become more of a defined contribution saving system that can be controlled financially better than its sort of defined benefit structure that it is now. By the way, you can build wealth for lower income, lower wage people faster this way. Third is to do premium support in Medicare, which I mentioned in my presentation. Fourth was to move toward mandatory managed care for people that are dually eligible for Medicare and Medicaid. These are the really expensive patients that get both Medicare and Medicaid. They're frail and elderly, and we have a disorganized system for caring for them now. And if we just sort of mandated that they had to get their care through some kind of integrated, organized system, it would make a big difference in terms of cost. Nothing would be taken from them. It would be to deliver what they're deserving now, just better. And there was a fifth, protect current beneficiaries. So those are sort of my kind of principles for moving forward on something. And we could do a bunch of other things. Also, I said, lower the replacement rate for higher income Social Security wage earners. So those are my list of things. If you did all that, you'd save a lot of money in 2050.
It's very futuristic. I don't know how our political system would be.
I don't think that's the Biden agenda. I don't think he'll be too interested in it.
Yeah. I know Grant has a question, but does anyone else want to ask before 5, or do you want to go to Grant's question? All right.
Yeah, sure. I can ask a question.
And if sorry, just 1 second.
No.
If you guys need to leave or you want to go somewhere else, it's almost 5 o'clock, so you're more than welcome to. And we're happy that you guys were able to come and discuss with us all these topics, but we're happy to continue going as well.
Yes. Thank you for everybody who, if anybody has to leave, thank you for coming. It's been enjoyable. I'm glad you were able to participate. Go ahead with your question.
Yeah, so earlier you had talked about a bill in 2021 where states would hopefully, address preventative measures, address similar outbreaks in the future. similar COVID outbreaks in the future. Could you talk about more like, so right now what I see in COVID, at least, there's a lot of data gaps in different states and how they get data, how they're producing data, what data is available to the public. For example, Indiana, you can get data like per county per day, but if you go to any of the neighboring states, that data is not available to the public. Do you see any federal regulations in data quality and how the public can have access to that sort of information?
Yes, I think that would be a big part of the, if they do another bill, it's almost surely going to involve some reforms to the CDC, just because things have gone so badly. And data, frustration with poor, delayed, non-useful data is rampant now, both in the Congress and in the executive branch. And CDC will say, hey, we got the antiquated systems dating back to the 1960s, and we need to update a whole bunch of stuff. And it's going to cost money. We need $5 billion just to update our data systems or something. Okay. So I think people will take a very hard look at that and probably put some big investments in it. Say we need to have a 21st century real-time modernized surveillance, testing, tracking data systems so that we all know what's going on, so that we can, as I keep saying, let's not do this again, Bill. Let's not do a repeat of 2020 anytime soon.
Right. Yeah, thank you for that.
Sure.
I'm personally curious on your take on, so I know from July, I remember that you were pretty critical of the Trump response to coronavirus and all that. But I wanted to.
It hasn't gotten, unfortunately, things have not gotten better in the last month. So.
Yeah, especially when he had it, but the public image. But I wanted to know, since July, I mean, a lot of students have returned back to campus. We talked about this before. And then even, especially K through 12, those kids have gone back to school and then they come back home to their parents every day. Right. So I was just like interested in your take on, mostly interested on your take of how people going back to school has influenced the view that we have on the coronavirus, like preventative measures that we've been taking as a community and as a country.
Yeah, sure. Well, I think there's many studies about the school-age children and their own susceptibility to the virus, their own ability to transmit the virus. There isn't that much about what happens when they leave their school settings and whether they're contributing to community spread or not. And so it's a little bit of a hole in the research and data at this point. Having said that, I think there are a couple of things that are pretty clear. One is that their risks for especially very, very little kids is very, very low. They seem to have innate immunity to this thing, and they don't get very sick very often at all. So even when they have it. So thanks be to God for that. I mean, it's like the one silver lining in this whole disaster, right, is that the effect on young people has been muted very substantially by their own innate immunity systems. As they get older, so the very youngest children seem the most protected. Then then you have elementary school, 5 to 10-year-olds, and then middle school and high school kids, 10 to 20. So they kind of all have different. The older they get, the more they look like the rest of us in terms of how susceptible they are to it and how much they transmit it. So that, I think, is what's going on somewhat in the schools, is that elementary schools are pretty safe if the community spread is low and you can protect the teachers and have the normal precautions. They seem to be able to do this fairly well, but this presumes that you've got it kind of under control in the community generally, right? And so that doesn't mean also that you're not going to have bad outcomes. If there's widespread virus and you open the school, you're going to have transmission in the school, and some of those people are going to end up transmitting it back to their families, and then it'll go into somebody who's more vulnerable. So that's going to happen. The question is degree and amount. So where are we on all that? I think the big frustration with all of this is that, I mean, frankly, the president seems to be acting against his own interests month after month after month. I mean, you're president of the United States, and it's the biggest crisis the country has faced in decades. People are going to look to you to say, hey, what did you do to kind of get this thing under control? And he's essentially abdicated his position and said he didn't really want to be responsible for fixing this thing, and has let it drift for months and months. And that's really hurting his political prospects. I mean, let's be honest, it's probably sinking him. And why would he want to do that? I mean, he wants to get reelected, right? So you would think he would understand that, something like this is a global pandemic. The governor of Indiana is not going to be on his own able to fix a global pandemic. It's going to require leadership from the president of the United States. And he just has not done it. He hasn't. For any whatever reason or advice he's gotten, I think has been, hey, if we kind of contain the virus, it'll slow down the economy. Frankly, it's the exact opposite, right? If you had done a better job in May and June and July, we'd be, maybe where Australia is now, right? But we aren't. So he's in bad shape,
Yeah.
because he's got the worst of both worlds. He's sort of let the thing run wild, and the economic benefits aren't there either. So I think it's just bad for him all the way around, right? The other thing that's perplexing is, you're president of the United States and you're trying to run on your record. I mean, you'd think he'd realize that a big stimulus bill right before the election would have been good for him, right? I think he realized too late. He sort of realized like a week ago, and then he started saying, I want a big bill. But they sort of dithered for weeks, and all the Republicans in the Senate don't want a big bill now. And now he wants one because he realizes it will help him, but he can't get it because he can't get the thing moving. So he kind of missed it. He could have had a deal probably in July, and he would have had another $2 trillion bill that would be, sending out $1,200 checks to everybody on October 1st, right? You'd think he'd realize that would have been a good thing for him, but they didn't do that either. So I think they're kind of a little bit, they're struggling for those reasons.
Yeah. So, I mean, you did talk about how the states really couldn't do that much because it is a federal state issue, but was there any governors or states that you thought that they did a pretty good job of handling it despite the fact that the federal response was poor?
Well, I think there have been a number of states that have done a pretty good job, but it doesn't fall neatly into a red-blue kind of dichotomy, frankly. I mean, there's some Republican governors that have done a good job, and some Democratic governors have done a good job, and the opposite. Some Democratic governors who haven't done a good job, and Republican governors haven't done a good job. So, and also it's a long haul deal. I mean, it's not something you can measure over a couple of weeks, right? You have to look at the whole course of this thing and say, who's managed this, probably 12-month, 15-month crisis the best over a full 15-month episode. And the jury's still out a little bit on that. But I think the states that are testing and tracing aggressively are the ones who are going to end up in the best position, I think, over the long run. If they're containing people coming into their states, so they're trying to operate almost like a country would and say, don't come here if you got the virus. And when you come here, we're going to check you to make sure you don't spread it around. And then we're going to have testing and tracing in the communities in a big way, tracking it and using it to manage the virus transmission. Those are the states that are going to end up doing the best. And, honestly, a lot of them are in the Northeast, but, some Republican governors and some Democrat. So, but, the jury's still out on some of these other states. I thought Indiana was doing pretty well, honestly. I think they've gotten a little bit loose lately, so we'll see what happens.
Yeah. Will, go ahead.
Oh, I was going to say, so how do you compare? I've heard a lot of comparisons between North Carolina and Michigan in terms of, states that have done, I mean, obviously I'm biased because I'm from North Carolina, but in terms of states that have similar population densities and similar overall gross populations, but have had vastly different COVID outcomes. But that doesn't really take into account, and I'm kind of playing devil's advocate here, but that doesn't really take into account temperature differences, because if you have a bunch of people that are out in the hot sun, of course, they're going to want to come inside and get closer to each other and then spread the virus more. So how do you compare states? Do you compare them more closer together, or in terms of population density, or in terms of ethnic makeup? Because I know there's disparities between races on this, or what's the best way to do that?
Yeah.
And then I guess in a broader question, how would you compare countries like that? Because like comparing the US to Canada, you have a similar issue in terms of like population density problems and temperature issues.
Yeah.
Um,
I mean, I think the things that are clear here are that, you know, in some ways, the US and Europe are in similar boats, okay, in the sense of Northern Hemisphere countries that are basically open, big, dynamic economies, same kind of political pressures, probably roughly the same kinds of demographic makeup in terms of these age profiles, maybe not totally the same ethnicity wise, but you know, probably pretty close. And so, you know, they're going to do broad comparisons between North America and Europe, you know, especially the US and Europe. And I think that's a pretty fair comparison, right? And neither one of them looked that good, right? So you might say that from that kind of a comparison, you might say, well, if we had a President Hillary Clinton, you know, what are the odds that she would have been down in Australia territory in terms of performance, or would she be more like France and the US and Spain and Italy, you know? And it's a little bit hard to know, honestly. You know, how much is fate and how much is governance? You know, there's a question there, I'll admit. But if I just look at the balance of evidence across everything, we could have done a much, there's no doubt the US could have done a much better job from basically mid-May to today. Sometime around mid-May, we just sort of said, we did our lockdown, we're not doing that again. We're not, you know, no public messaging around masks, no messaging around, you know, avoiding big crowds. This is at the federal level. Lots of mixed messages coming out of CDC. Too early communication about opening the schools before the states had even gotten. You know, their biggest crime was they put out this guidance. Remember the thing that Fauci and Dr. Birx and the White House put out in mid-May.
Sorry to interrupt, but is this the mask one saying don't wear masks, or
No,
wear masks?
No, this is different. This was the gateways. Remember the phase 1, phase 2, phase 3, phase 4 gates criteria? So they put out these criteria that says, here's the criteria you got to go to open from 1 to 2 to 3 to 4. They put them out, and basically nobody at the federal level and nobody at the state ever paid attention to them ever again. They just sort of threw them in the garbage can, and they just started opening based on their own criteria that had nothing to do with those. And so, you know, that's why we ended up with this massive summer surge, and here we are.
Professor Lankowski.
Yeah, I just wanted to make two related points. At the beginning of all this, I did some reading on the history of past pandemics. And
just a very cheerful nighttime reading. Yeah.
Well, you know, us social policy types. I mean, one interesting thing during the entire so-called Spanish flu, the best scientists in the world had no idea what was causing it. They didn't isolate the virus until the 1930s. But one of the things in the subsequent waves of the flu is they tended to strike at places that had not been heavily affected by the previous waves. It'd be interesting. I mean, I've just been looking at, you mentioned Indiana, and I've been looking at very raw data that we see on the state's dashboard. And it looks like the current surge we're seeing is not coming from Marion County, Indianapolis, and the suburban counties, but I notice it seems to be coming from places like Evansville and over in the southeastern part of the state, which were much less affected earlier. So it would be interesting. I mean, I think probably the explanation would be places that had been hard hit initially develop patterns. I mean, it's not a herd immunity explanation.
No.
It's really that they had developed patterns of one sort or another, and the population had taken it much more seriously than places where it had, which gets to my second point. This is something that Yuval Levin, who I think we've now got him scheduled for November here, and I have been talking about. I'm hoping to do a Liberty Fund seminar on this next year.
Good.
The question is there something about the American population that's different? A historian up at the University of Michigan observed that he seemed to think that during the 1918 influenza epidemic, the American population had a much higher sense of civic duty. There were anti-mask efforts and groups in 1918, but overall he felt, and you could see this in the activities of the Red Cross, and some joining the Red Cross and those, there's almost a patriotic duty, were much more involved. When you talk about, we get to May, yeah, there was conflicting information out of the White House, all sorts of stuff. But at the end of the day, we know, and this is what you and I worked on when we were together in the Bush administration, we know that kind of voluntary associations, civic associations, civic participation in the United States may not be what it used to be. We are, in the words of Putnam's famous book, bowling alone. And one wonders, as a result, whether we can really muster the kind of civic or social response necessary to deal effectively, or for that matter, any modern society, Britain, etc., can do this in the way in the past we may have done. And so we turn to various mandates of one sort or another, but now we're seeing courts strike them down as infringements on due process and so on, not to mention the more extreme reactions of wanting to kidnap the governor of Michigan. But so I was wondering, it's really not a question. I know you've been talking to Yuval about this, and I suspect there have been corridor talks at AEI about it. What about this? Is part of the problem that the United States, just to use a phrase, is a good deal less united than it might once was and needs to be to deal with a crisis of this sort?
Yeah. Well, the question is whether our political leadership is kind of aiding and abetting and acting in concert with that tendency, or kind of facilitating it by not pushing back on it. In other words, take the counterfactual. What if President Trump got up May 15th and said, "We've done a great job. We've locked down the country. We've gotten past the New York Northeast crisis. We're getting our testing system up, but we're going to have, another couple of months of difficulty here while we build up a system so that we can get back to normal in the second half of the year. Everybody has to wear masks at all times. We're going to get a vaccine as soon as possible. You can only open up in your communities if you keep the thing under control with a good testing and tracing system. And everybody's got to wear masks on planes, in federal buildings. I'm going to enforce it. We're going to wear it here at the White House. Everybody should work remotely until, we get the systems up in place. And we're going to test until we figure out where the virus is and keep it under control from there." Now, obviously, this is not a speech President Trump was prepared to give. Let's assume he had given it, right? What would be the size of the remaining, kind of non-compliant population? The people who say, "I'm not going to do that. I'm not going to wear a mask. I'm not going to agree to these restrictions. I'm going to go about my business and forget it." It'd still be there, but it wouldn't be 40% of the population, right? It'd be 10% maybe, or 5 or something, right? So my view is basically that the public will kind of in these pandemic preparedness plans that are sitting around that nobody ever looked at, number one item on the thing is basically health communications, public health communication, consistent, clear directives about how to get through this together from on top. The president probably only had to say it once, and then he'd hand it off to somebody else and say, keep saying it and keep saying it and keep saying it. And then you wouldn't have to do it all the time through the White House. That's what they had recommended, right? But they didn't do that. So, you know, I agree with you. We bowl alone, and we have a lot of libertarian, big libertarian streak in this country. And a lot of people would kind of chafe at the whole thing. But if the whole system was stood up to say, you got to do it, you know, because it's not really in your interest, it's for your neighbor and the people down the street. And we're the government. We say we have to do this together. Otherwise, you know, you're going to make everybody sick. If that message was delivered consistently, I don't know. I believe we would have had a much higher compliance.
Yeah, Garrett, Ty, Will, did any of you want to ask anything or continue with that?
I think that's a really cool message. I mean, I'm begrudgingly a basket. I'm a biostatistics person, but begrudgingly a basket weaver because it's a public health. But I really wish people thought about things this way, because like the public health part of my major, whenever I think about it, I'm like, okay, it's common sense to like help the public with whatever you do. And so there was like a humanities part of my education, and that's really kind of like what it's promoted, but it didn't really talk about it from like, it talked about from like a community sense, like, you know, what you can do to promote to like help your community and how to encourage like civic engagement on just like a local level, but nowhere near a federal level. And I think that's something that that we really need in this country right now, especially not just from President Trump, but from local senators and politicians, because I feel like that message isn't really getting across.
Yeah, it is a big country. So, I mean, I agree with the White House's sort of point when they say, you know, it doesn't make sense to have a one size fits all deal at all times in every place, right? If there's nothing going on and there's no transmission in the community, we're not going to have a national lockdown. National lockdown isn't the greatest idea. You know, you don't really want that. That's not the same thing as saying that, okay, Texas and Florida, do whatever you want, because those people end up, you know, that virus that gets rolling in one of these other places rolls into another place too. So we are one country, and there's lots of viral transmission across state lines. It doesn't just stay in a state. And
exactly.
So what goes on in Texas, I care about it in Virginia, you know, and because some of that will spill over into other places. And so, you know, we have the other thing is that Canada and, you know, New Zealand and Australia and we and China and every other country has understood that, you know, controlling the borders in terms of who's coming in and making sure they don't have the virus is a big deal, especially early on. And so, yeah, you know, let's do that. But once you're talking about, are you really going to have, you know, what are you going to do? Put up a wall between, you know, Indiana and Illinois and not let people come across state lines, right? It just doesn't work that way. So, you know, you're going to have a lot of things moving around. You got truckers driving all over the country, right? And so there's no way to avoid that there's a big national coordination system that needs to be part of this. It's a pandemic. I mean, yes, public health is mainly a state responsibility, but that's because, you know, you're talking, a lot of things are transmitted locally, you know, and they don't have the ability to become a pandemic. But when you have a pandemic where it can just spread like wildfire across the whole country, yeah, you need a national response.
Well, yeah, and that's what I really like about the whole federalist system, especially in response to public health crises like this, is because, for instance, South Dakota used to be not hit by it at all, but right now they're being hit by it a lot because cold's coming early for them, so they're all going indoors. And now the governor there could issue a mandate. I'm not sure the South Dakota governor name. I'm sorry, I don't know off the top of my head, but basically they can order an issue right there, being like, okay, not only locally do we need it, but now temporally do we need it? So maybe like have a national or not a state mask order for the next like X amount of months.
Yeah.
But then like they wouldn't need it other than that. Like until now, I think they were pretty much not COVID free, but they were doing very well compared to other parts of the country. So that's something I really like about the whole federalist system. But
Right.
it does need to be a top-down initiative of like, hey, take responsibility, but not really sort of like an authoritarian. And then that whole responsibility message that Professor Lenowski, sorry if I'm butchering your name,
Lenkowski.
Professor Lenkowski was saying, I think American people respond a lot better to that rather than like sort of an authoritarian
Yeah,
CCP message.
Of course, yeah. I agree too. Anybody else? Been great to be with you guys this afternoon.
No, yeah, I mean, I really appreciate you coming and talking to us for so long. I mean, I do want to be respectful of your time too. So
I'm okay for another minute or two, but is anybody, we're down to the really hardcore people now. So
people who care, yeah.
Well, I just want
Maybe
to
I
say,
could.
oh,
Okay, go ahead, Will. Otherwise,
I just wanted to say Ty's mask is really cool, and I wish I had one with my school. That's all.
Jim, maybe I could prompt you a little bit because, again, you and I served together. You were actually there before I was, 9/11, when we had another attack, a real attack. And, you know, the Bush administration, President Bush, you know, that famous scene where he's got a bullhorn in what used to be the World Trade Center, you know, the State of the Union of 2002 and so on. What's changed other than the obvious one? I mean, is there something more that's changed in the capacity of political leadership besides the replacement of Donald Trump of George W. Bush with Donald Trump, or is it as straightforward as that?
there's certainly, you know, I'm of the view, like a lot of people, that he's the president is both a symptom and a cause. You know, he accelerated a lot of, you know, the dynamics that led to the political environment we're in. He himself was a contributor to the birther movement and, you know, the whole thing, right? So he wasn't just sort of a bystander and then took advantage of it. He was there with some gasoline, pouring it on the fire, you know. Having said that, the original spark probably was a populist reaction against a series of very high profile failures, right? So I think the now I hate to say this because I worked for the president just like you did, Les. I mean, that the bracketing the Bush administration years, and President Trump took total advantage of both of these things, was the Iraq War, which is widely perceived now as being sort of an unwise series of events. Whether that's fair or not, I'm just saying that's the main public perception of it. And neither party will defend going into Iraq. I mean, the number of people who defend going into Iraq under the conditions that it happened in 2003 is like, 10% of the party. It's John Bolton and a few other people, And so that's the fact that was a big decision, and people perceive it as not being the right decision now. Didn't work out great. Contributed to an environment where distrust for the establishment and elite opinion was really brought into question. The second big event, of course, was the financial crash because of how it hit people so hard, and the slow recovery in its aftermath. And I think between those two things, you just have people saying, nobody saw, mainstream economists did not see the crash coming, didn't predict it, and it was really bad. And it felt like it was elites, gambling away other people's money. And so between those two events, you had sort of the dry wood of a populist sort of revolt, you know? And then Trump comes in with, you know, it's all our problems are due to foreigners and the birther movement and, you know, the wall and, you know, just kind of, he stirred it up even more, right? And I think that's where we are.
Sweet. Thank you so much, Mr. Capretta. I mean, you've been really influential to my learning, I can say, since June, since we had that class. I think Ty and Will would echo that sentiment in some regard.
Good.
Yeah,
Well,
completely.
you guys
It's
give me
been
an hour and a
phenomenal.
half just to opine and spout off. So, you know, that's always fun, right? So thank you for letting me talk. And I wish you all well the rest of your semester, and great to see you, Les. And thank you for joining and inviting me to come.
Thank you. All right. Have a good day, everyone.
Okay.